There are two types of diabetes, which consists of type 1 and type 2. It is important to understand the distinction between the two and how both are treated. Type 1 diabetes is commonly found in children and/or adolescents, but may also occur in adults. With type 1 diabetes, there is almost always a complete deficiency of insulin. As a result, the most common treatment is insulin injections, a lifestyle that consists of both diet and exercise and regular monitoring of blood glucose levels with the use of blood testing monitors. Patients who have been diagnosed with type 1 diabetes can continue to enjoy a normal life providing they continue with their treatment and take special care to follow their doctor's instructions and/or recommendation. With type 2 diabetes, an individual's insulin level is usually either normal or sometimes even elevated, but is not deficient. This form of diabetes is believed to be more complicated than type 1, but ironically is thought to be easier to treat. Because insulin is still being produced inside the body, type 2 diabetes often goes undetected for years. Symptoms are milder and may even be sporadic, which often reduces the level of concern. The main problem with type 2 diabetes going unnoticed is the potential for serious complications, including renal failure and coronary artery disease. The initial treatment phase of type 2 diabetes will likely include a lifestyle adjustment to feature increased physical activity and a diet that is geared toward weight loss. The next step, if necessary, will be medication and possibly insulin therapy if needed. Both types of diabetes require that the patient maintain normal blood glucose levels in an effort to reduce the possibility of organ damage, including eyesight, kidney, blood circulation, etc. In order for this to occur, patients must carefully monitor their food intake and make sure to participate in regular exercise, all the while continuing to monitor their blood glucose level. As of 2006, there is no known cure for diabetes. A chronic disease that affects many, diabetes is best treated through patient education, nutrition, self-awareness and long-term care. In addition, patients are often urged to be aware of other symptoms that may indicate complications arising from diabetes. The contents of this video are to be used for informational purposes only. It should not be used in conjunction with, or in place of, professional medical advice relating to diabetes. This video must not be used as a basis for diagnosing or treating diabetes, but rather an informational source designed to explain the difference between the two types. For further information, a diagnosis or recommended treatment method for diabetes, individuals should consult a licensed physician. Type 1 diabetes accounts for 5 to 10% of diabetes cases in the United States. A person who is diagnosed with type 1 diabetes must receive insulin shots daily in order to live. Scientists are not exactly sure why the body attacks the immune system and the production of insulin, but it is believed that both genetics and viruses are involved. Type 1 diabetes is most commonly found in children and young adults, but can appear at any age and symptoms can develop over a short period of time. Symptoms include increased thirst and urination, extreme fatigue, weight loss and constant hunger. If a person with type 1 diabetes is not diagnosed and treated with insulin, there is a risk of that person slipping into a diabetic coma that may prove life-threatening. The key when first diagnosed with type 1 diabetes is to arm yourself with information. Being diagnosed is not the end of the world. In fact, most people go on to live normal, healthy lives as long as they stay aware of their condition and continue to treat it. After being diagnosed with diabetes, it is important to maintain your general health, paying special attention to the care you give your eyes, feet and skin as well as your heart and oral health. This basic care could prevent complications brought on by diabetes later in life. Other recommendations are to stop smoking and reduce the amount of alcohol you consume. Type 2 diabetes is the most common form found in the U.S. 90 to 95% of people diagnosed with diabetes have this type. Usually developed later in life, it is most commonly diagnosed in people over the age of 55, but in many cases as young as 40 or even younger. This is because 80% of people diagnosed with type 2 diabetes are overweight. With obesity at an all-time high, the diagnoses for type 2 diabetes is also at an all-time high. In type 2 diabetes, the pancreas is still producing insulin, but for some unknown reason, the body is not able to utilize it effectively. As a result, just as in type 1 diabetes, type 2 people develop a dangerous buildup of glucose in the blood and the body is not able to utilize it for fuel. People who have type 2 diabetes may see their symptoms develop over time. They are not usually as noticeable as the type 1 symptoms. Symptoms include fatigue, frequent urination, especially throughout the night hours, unusual thirst, weight loss, frequent infections and slow healing sores. In fact, sores may never heal, and if not treated, it is common for people to have limbs amputated. This usually occurs in the legs, feet and toes. Also, as with type 1, if the symptoms go untreated and insulin is not administered when necessary, the patient runs the risk of slipping into a diabetic coma, which can be fatal. It is important, if you have any symptoms of type 1 or 2 diabetes, you speak with a health professional and get tested. If you or a loved one has type 2 diabetes, you're not alone. More than 18 million Americans have type 2 diabetes. For many people with type 2 diabetes, controlling blood sugar is a struggle every day. In fact, a report issued last year by the American Association of Clinical Endocrinologists, AACE, showed that 2 out of 3 Americans with type 2 diabetes analyzed in a study were not in control of their blood sugar. It is important to control blood sugar because it lowers the risk of serious health problems later. Diabetes can cause heart disease, stroke, blindness, loss of limbs and kidney disease. But now, there's new help to better manage type 2 diabetes. Life and fitness coach Bob Harper of NBC's The Biggest Loser, and a panel of diabetes experts created easy-to-understand and motivational steps people can take to get their blood sugar down. They are called 6.5 steps toward better blood sugar control. These steps are different because they can fit easily into everyday living. Through my years of coaching and training, I've worked with many people with type 2 diabetes and have seen how hard it can be to live with this disease, said Bob Harper. But I learned that anyone can change their life. It's all about finding the right tools and motivation. I urge people with type 2 diabetes to step it up and use the 6.5 steps and make them a part of their daily lives. The 6.5 steps can help people with type 2 diabetes every day because they focus on the basics of diabetes management: eating healthy, being physically active, monitoring blood sugar and, when appropriate, taking 1 or more medicines. These all play a part to help lower blood sugar. Healthy eating. Healthy eating reduces the risk for complications such as heart disease and stroke. Good choices include many foods, such as vegetables, whole grains, fruits, non-fat dairy products, beans, and lean meats, poultry and fish. There is no one perfect food, but watching portion sizes is key to a healthy diet. Physical activity. Regular physical activity can lower blood sugar levels. It can also help manage weight and reduce the risk of developing heart disease and high blood pressure. There are little things people with type 2 diabetes can do every day to be more active, such as walking with a friend or taking the stairs instead of the elevator. Blood sugar monitoring. There are 2 tests for checking blood sugar. One test is the blood sugar monitoring that patients do on their own. It gives people with diabetes a check of their blood sugar level at the time the test is taken. The other one is called the A1C test. The A1C test shows a person's average blood sugar levels over the previous 2 to 3 months. Experts say that a good A1C goal is 6.5% or less for most people with type 2 diabetes. Medicines. Most people with type 2 diabetes take medicine to help control their blood sugar levels. Many need more than one medicine to help treat the disease in different ways. For people with type 2 diabetes, it is important that they team up with their doctor or other healthcare professional and think of them as a partner. They should work with their healthcare team to make a plan to get their blood sugar under control. Nowadays, diabetes treatment has become a common disease among people. It is caused due to mismanagement of carbohydrate metabolism inside the body. Diabetes is identified with the excessive production of urine, hunger, thirst and excessive loss of weight, blurred vision, and delay in healing of skin, repeated infection, and excessive fatigue. Diabetes has got a serious issue of human health. It denotes sugar in blood and urine very excessively. So, when it comes to treatment of diabetes, the main concern should be given to control blood sugar, which is main cause of diabetes. Managing blood sugar is the stepping stone of this diabetes treatment program. To remove the complications of diabetes, one must take it seriously and adopt some good diet process or healthy exercise. Apart from doing so, some take insulin and any other type of medication program to be cured to some extent. Frequent testing of blood sugar can denote you how much you have improved on your part to manage suitable measure of sugar in blood. It is very important to learn the right range of glucose in blood unless and until you cannot have the idea about the complication you are facing about this disease. It depends on age mainly, such as in younger age, assuming not much complication, as there the suitable range of glucose is 80 to 120 mg per deciliter, and in older age it is 100 to 140 mg per deciliter. Diabetes program includes some specific self-treatments like having good and suitable diet, having proper exercise, maintaining healthy weight, and medication. When it is about good and suitable diet, it does not make any suggestion to take all dull food which are not of your interest, rather it denotes to have more fruits, vegetables and grains. That means you should be conscious in taking the foods of high nutrition and lower fat and calories. Avoid taking sweets and animal products with no limit. The main part of this diabetes treatment program is that you own self should be challenging in this task, otherwise this program will be harder enough. Consult any dietitian about meal plan and try to maintain it at the fixed times every day with same amount according to your diet plan. On the part of having proper exercise, you should be cautious about all aerobic exercises. In this diabetes treatment program you can make your choices among the daily exercises like doing morning or evening walk, jogging, hiking, biking, swimming and any other exercises of heart and lungs. Remember, giving consistency to your exercise process is very important to get the best result through it. Try to maintain weight according to your activity level and age, because overweight is a dangerous factor which help to make your cells more resistant to insulin. Making suitable weight loss plan and going according to that can make its result more effectively. Sometimes medication takes a very important role in case where it is found that good dieting and exercise are not fulfilling its purpose. This type of diabetes program includes the insert of insulin as per requirement. As it can't be taken in form of pill, some people have it injected by syringe or some have it with insulin pump. So now it is very clear that diabetes is always manageable if the sufferer give a serious daily attention to it. Although diabetes stands for lifelong suffering, yet it never means the end of your life. You just have to remember that the disease will be in your control only and only if you are self-disciplined for your each and every step of treatment program. Disclaimer. This information is not presented by a medical practitioner and is for educational and informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read. Since natural and/or dietary supplements are not FDA approved, they must be accompanied by a two-part disclaimer on the product label. That the statement has not been evaluated by FDA and that the product is not intended to diagnose, treat, cure or prevent any disease.